Hello guys, my name is Nightwolf, and welcome back to Surgery Games. So this time we are doing an Adeniodectomy right now, and I have a couple others I want to do too. We're almost done with the Surgery Games.
Hello, and welcome to Surgery Squad's virtual Adenoidectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today.
Adenoidectomy?
Our adenoids are located at the back of the throat, just below where the nose connects, also known as the pharyngeal tonsil. They are part of our immune system because they protect us from the bacteria or viruses that might enter the body when we breathe or swallow. They are more important for children than adults, and they shrink as we get older. In some adults, they become inflamed, which can lead to infections, sleep apnea, better known as snoring, and ear infections, since enlarged adenoids might block the eustachian tubes, which drain fluid from the ears into the throat. Normally, these symptoms can be treated with antibiotics, but when these infections occur more frequently, we perform an adenoidectomy to remove them. Having an adenoidectomy, if it is required, can reduce the number of ear infections, reduce recurring chances of sinusitis, and can alleviate sleep apnea. However, there's a risk of developing an infection at the removal site. Plus, the procedure might not alleviate all the problems associated with adenoids. For instance, if ear infections continue, the problem might be elsewhere. Our patient today experiences sleep apnea and ear infections. Let's scrub in and get to work. We'll need to use a general anesthetic for our patient. Why don't you help out? Can you find a suitable vein in the patient's hand?
Right, there's a suitable vein.
Looks good to me. Sterilize the injection area using a sterile alcohol wipe.
Oh, you mean right there. Okay. Right there is also a suitable vein.
Insert the needle and advance the angiocatheter into the vein. The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed.
We'll have this episode, and then another one, and then that will be it. I might do 2 today. Well,
now that the needle has been removed, I'll dispose of it in a sharps container.
Yeah.
We need to secure the IV with tape and test the line. Great!
But yeah.
Now we'll wait a few minutes for the anesthetic to take effect. One more thing. Since we'll be working in the patient's nose and mouth area, we'll need to make sure he can breathe. Let's insert a breathing tube into one nostril.
Okay. Breathing tube in the nostril.
Great job! Our patient is under and breathing. Now we're ready to remove the adenoids. We'll begin by putting an endoscope through our patient's nose so that we can view our work on a monitor. When we reach the back of the nose at the entrance to the throat, we'll be able to see the adenoids. Okay, good. Now we can see the adenoids. We need to open the mouth and get the tongue out of the way so we can begin our procedure. To do that, we'll use a special retractor that opens the mouth, depresses the tongue, and locks into position. Great work! We're going to remove the adenoids using a device that uses suction cautery. The device uses electrical pulses to liquefy the adenoid, then suctions the liquefied adenoid out. This method is faster and results in less bleeding.
We're basically spiderifying him. Are you removing all of it? I think we are removing all of it. So basically this is what a spider does to a bug. Except the spider takes a lot longer than this. What is that, though? All
Fantastic! The
Yeah.
adenoids are gone. Now all we have to do is remove all of our equipment and get our patient to recovery.
What
Our
is
patient
that?
is in recovery, and he'll be able to go home in a few hours once he can breathe easily, cough,
Is that
and swallow.
spine?
We'll prescribe some antibiotics, and once he
Yeah.
gets home, he needs to drink plenty of water to keep hydrated. He'll also need to stay away from solid foods, but he'll get to eat ice cream, sherbet, popsicles, and jello for a couple of days. He might experience a burned taste in his mouth, which will subside after a couple of days. He should brush his teeth often to help alleviate that taste. Scabs might form in the back of his throat from the surgery, and, of course, he should contact his doctor if there's bleeding or excessive pain from where the adenoids were removed. You did a great job today. Try your hand at one of our
Yay.
other surgeries here at surgerysquad.com.
Tattoo removal and the childbirth with epidural. Well, let's do none of those. And actually, let's do a liposuction.
Welcome to Surgery Squad's virtual abdominal liposuction. I'm
That
Dr.
sounds
Susie,
different.
and I'll be assisting you with this surgery today. Liposuction is a minimally invasive surgical procedure that is used to remove fat deposits from various areas of the body. The areas that liposuction is generally performed are the abdomen, hips, inner and outer thighs, flanks or love handles, and inner arms.
Oh,
Today we'll be using the Tumescent technique to remove fat deposits from our patient's abdomen. The word tumescent means swollen and firm, and with this technique we'll be injecting such a large volume of the fluid into the fat deposits that our patient's abdomen literally becomes tumescent. After injecting the fluid, we'll be using a hollow metal tube called a cannula to break up and essentially vacuum fat deposits out of the body. Before we begin, remember that liposuction is not an alternative to diet and exercise. And, unfortunately, not everyone is a good candidate for liposuction.
okay.
To be a good candidate, one must usually be over 18 years old, in good general health,
Okay.
be within 30% of their ideal weight, and have made an honest attempt at losing weight through dieting and exercise
Okay.
with little success. Luckily, our patient is not only a great candidate for liposuction, but she doesn't smoke, which will greatly speed up the recovery process.
That's
Now that
good.
we've covered the basics, let's scrub in.
Smoking is bad.
The first thing we need to do is mark the target area. This provides our patient and ourselves with a clear idea of where we'll be removing fat deposits. Why don't you give it a shot?
Okay, so let's try to do this. See, normally you would do. That, like the, you know, dash that it shows. Should do that. Right there, right there. There we go, and there we go. And then let's draw yeah.
That looks great.
Oh.
Now we need to take photos of our patient so she can see the before and after
I'm not a
results.
good drawer.
Go ahead and take one picture of the front of the patient's abdomen.
Okay.
Next, we'll have our patient turn to the side so
That's
you
not
can take the
that
second
bad.
picture.
I mean, it's not that bad, okay?
Nice composition. Our patient has been prepped and is now in the operating room. The next step is to numb the incision points that we're going to use to extract the fat deposits. Give it a try.
Ugh. Yeah, stick it about there. Let's stick it right there. Let's stick it right there and right there.
With the incision points numbed, we're going to inject the tumescent fluid using an infiltration cannula to anesthetize the target areas and dislodge the fat deposits, making it easier to suck them out. Go ahead and take a stab at it.
Stuff right there. Ooh. That sounds like a drill. Are we drilling in this person? And how that you wait for this? Oh, I saw it lift. Now you have a 4-pack.
Excellent job. Now that we've injected the tumescent fluid, let's begin the liposuction. Use the suction cannula to remove the fat deposits from the patient.
Oh yeah. Oh, I can't reach that one? Come on. I could totally reach that one. Boom.
You're a natural.
Yeah.
Have you ever considered a career in the medical field?
Nope.
Now that we've completed the liposuction on our patient, it's time for recovery. We're not going to suture the incisions. Since they were so small, they can heal without sutures. Our patient will need to wear a compression garment for 2 to 6 weeks. This garment holds the tissues together, controls swelling, and provides additional support as her body heals. She should be able to return to normal activity within a few weeks, and there will still be some bruising that should fade within a few days. Any swelling that our patient has may take a little while longer to subside. The final result of the liposuction will be evident in about 1 to 3 months after the surgery, although they will see a noticeable difference within days or weeks. Although the suctioned fat deposits are gone, if the patient does not maintain a proper diet and exercise regimen, the remaining fat deposits could enlarge, creating irregularities in the patient's abdomen. And that's abdominal liposuction.
Okay.
You've done a fantastic job. Why not try your surgical skills in another great surgery
Virtual braces.
here at surgerysquad.com.
And virtual hair transplant surgery. Well, luckily, let's do a eye surgery now. We aren't doing any of those. No, not yet. Eye surgery.
Hello, and welcome to Surgery Squad's Cataract Surgery. I'm Dr. Susie,
Yeah.
and I'll be guiding you through this procedure today. A cataract is a clouding of the lens inside the eye. The lens is located behind the pupil and focuses light on the retina. A cataract causes loss of vision that can't be corrected with glasses, contact lenses, or even LASIK, so it must be surgically removed. We are going to remove the clouded lens and replace it with a new one called an intraocular lens, or IOL. The surgery takes about an hour and can be done on an outpatient basis. Today, our patient is a 66-year-old woman who has noticed an increased blurriness in her vision, as well as decreased night vision. She saw her eye professional and she detected cataracts and recommended her to us for surgery. Let's begin. First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put her to sleep.
Okay.
Just prior to surgery, additional drops of anesthetic are applied.
In her eye.
We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please. We begin the surgery with a small, painless initial side port incision. This is called a limbocorneal incision. It's done by making a small cut in the limbus with a crescent knife.
A crescent knife? Ugh.
Next, we use the crescent knife to make a corneal tunnel into the interior chamber of the eye. A thick, transparent viscoelastic fluid is injected to fill the space between the cataract and the delicate underside of the clear cornea in front of it. This is done to keep the cornea from collapsing during the procedure. Help me out and inject the fluid into our patient's eye. Now we need to make a 2.85 millimeter wide incision at the edge of the cornea for the cataract removal. This is done with an extremely thin diamond scalpel. A bent needle is inserted into the incision and used to poke a hole into the clear sac that holds the lens with the cataract. The needle is dragged to cut a line in the sac. With the incision made, we'll insert the forceps to grab the torn sac and tear a circle out of it. Now you will need to inject fluid into the incision to separate the lens from the capsule.
And they'll wait for all of this.
This causes the lens capsule to float so that it can be rotated during the next step. We'll now perform phacoemulsification, or phaco. This is done by using ultrasound to break up the affected lens so it can be removed from the eye. To do this, we pulse and drag the device to cut across the cataracted lens.
Okay. Oh, hello.
We repeat the phaco from the other direction to create 4 pieces.
Hi.
The phaco is then used to suction out the pieces of the old lens. I'll need you to remove the last remaining soft cataract material out of the eye, leaving behind the clear, empty lens capsule.
Do you know what?
When you're done, inject
orange.
more viscoelastic
I
fluid
don't.
into the lens capsule to keep it from collapsing. The flexible intraocular lens is rolled up for insertion by the assistant and placed in a soft tube. The IOL is now injected through a tube into the vacant lens capsule. A probe is used to spin the lens into place. The thick fluid we added to the eye will need to be removed, and any remaining microscopic cataract fragments should be rinsed out as well. The incisions in the eye are generally self-sealing. Very rarely that we need to add a suture to close the incision. In our patient's case, we don't need any sutures. The lens is now in place. Our patient will need someone to drive her home after cataract surgery.
Makes sense.
And she shouldn't drive until she's cleared at her follow-up appointment tomorrow. We'll prescribe medicated eye drops to use several times each day for a few weeks after the cataract surgery.
Anyway.
And she'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses will also need to be worn to protect her eye from sunlight and other bright light as her eye recovers. You did a great job today, surgeon. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
double mastectomy surgery, and silicone breast implant surgery. Well, we are going to be doing any of those right now. Next, we are going to be doing a laser tattoo or rhinoplasty, hair transplant procedure, root canal, and laparoscopic gastric bypass. Let's do or do we want to do one of these? Let's do phone. Quiet. A hair transplant procedure. And then the others we will leave.
Welcome to Surgery Squad's virtual hair transplant.
Yeah.
I'm Dr. Susie, and I'll be assisting you with this surgery today. A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery.
Okay.
Today we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Okay. Let's just continue. Yeah, all sudsy happy, yeah. Come on, get all done.
So fresh and
I
clean.
didn't do that.
Thoroughly rinse the patient's hair and we're ready to get started.
You get a shower.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Okay. Come on. Right there. And let's go this, and this. Yeah.
That looks good to me.
Aww.
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
Okay.
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
Okay. Yeah.
Great job! Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience. Great! He won't feel a thing! Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
There we go. And there we go.
Next, we remove the piece of scalp from the donor site. Make sure you have a good grip. Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Yeah, can do.
Great, let's get to some dissecting. The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor. Nice job! This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
Let's do there and let's do there.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions.
What? You do that many times?
Perfect. With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Yeah, yes please. Get that shit cleaned up.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
My God, really? Each one of those holes has to have a hair in it?
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
Virtual C-section and virtual LASIK eye surgery. It might do the C-section, but that will have to wait till next time. Because for now, I'm going to yawn and in this video here. So, make sure you guys like and subscribe, and I will see you guys on Monday. Have a great weekend and